living longer, living healthier, living better than ever before. Welcome to Mountain Pacific's Healthy Living for Life, a weekly series that gives you the information, education, and expert insight you need to become an active participant in today's ever-changing healthcare climate. Here now is today's program host.
It beats more than 100,000 times a day and more than 35 million times per year. You guessed it, we're talking about your heart. Do you know what you can do to improve your cardiovascular health? On today's show, we'll talk about how you can be cardiovascular healthy and about cardiac rehabilitation. Welcome to Healthy Living for Life, a show dedicated to helping you do just that. I'm Lisa Sather, your host. We'll be right back. Welcome back to Healthy Living for Life. Joining us on today's show is Britt Ballinger from St. Peter's Hospital, who's here to talk about the cardiovascular system and cardiovascular health. Thanks for being on our show again, Britt.
Thanks for having me.
Absolutely. So when we talk about the cardiovascular system, what organs exactly are we talking about in the body?
Well, the big players in the cardiovascular system are, of course, the heart and then the blood vessels that carry the blood cells to all the tissues. So it all kind of works synergistically, but the big players that we focus on are the heart and the blood vessels.
Okay, cool. So can you give us an overview of some of the types of cardiovascular diseases that are most common?
Mm-hmm. The most prevalent one that people can prevent is hypertension. That's high blood pressure, and that has to do with the constriction in the blood vessels, and it's very hereditary and very treatable. Over time, that can cause damage to all the organs, especially the heart. And of course, there's coronary artery disease, which is blockages in the arteries that feed the heart muscle. There's arrhythmias that can cause electrical problems, causing the heart to beat erratically. Those are the big ones that we treat in cardiology. Okay,
awesome. And so if someone has a heart-related event, how does that person know if he or she would have heart disease or a heart-related condition? I mean, how would you know that?
If you are feeling generally fatigued, of course, women have more vague symptoms than men. Men have the classic crushing chest pain more often, although I've seen women have that too. But just vague general fatigue, shortness of breath, chest pain, of course, that mostly on the left side or radiating up into the jaw or through the back. But if you're just not feeling right, it's a good idea to go in and see your doctor.
You were speaking about women. That brings to mind to me too. Are women more likely to have a cardiovascular event than men? Are there stats that tell us that?
They're not more likely to have an event. They're more likely to die of it, partly because their symptoms are a little more vague, but also partly because women tend to ignore things and downplay them. They are affected at a later age. Men start to be at higher risk at age 55, and women start after menopause at like 65.
Okay, thank you. So if a person thinks she or he may have a heart condition, what do you recommend? I think you kind of hit on it earlier, but
yeah.
Any other?
Well, just doing the general things for good health. Exercising every day is a really important thing to do, because if you start to feel bad, then something's not right. But it's also just good for your health. Controlling your blood pressure. If you're diabetic, keep it controlled. Get regular checkups. Talk to your doctor if you have concerns. If you have a family history, definitely keep an eye on your cardiovascular health.
So one of the big questions that always comes up is, what is the difference between a cardiac arrest and a heart attack? I think people always are interested in knowing how that works.
Okay, so a cardiac arrest is when the heart beats too fast to deliver blood to the tissues or stops altogether. A heart attack is when there's a blockage in the blood flow to the heart muscle. A heart attack can lead to a cardiac arrest, but they are different things and they can be separate.
So is one of those more likely than an electrical type malfunction then?
The cardiac arrest is more of an electrical malfunction.
Okay. What would be the symptoms of a cardiac arrest then if someone was experiencing that they would be needing to look for?
Usually a cardiac arrest is just someone goes down and passes out. Sometimes it can be temporary pauses in the heartbeat or arrhythmia that resolves on its own, so they could have chest pain or shortness of breath or pass out and then wake up.
What are the causes of sudden cardiac death? We hear that.
Some of it's genetic, Some we can't, so a family history of sudden cardiac death is really important to be aware of. If you have coronary artery disease, you may be at more risk for that. If you have had heart trouble in the past, like cardiomyopathy where your heart has weakened, you are at a higher risk for sudden cardiac death.
Okay. Anything else you want to hit on that we haven't hit on just in these few moments? We do have a little bit of time before we have to go to a break.
Okay. The biggest risk factors for coronary artery disease, which is more preventable, cardiac arrest can be related to coronary artery disease, but the other causes of cardiac arrest are not really preventable. They're genetic. So to give yourself the best chances of having a good outcome cardiovascular wise, it's the best idea to control your risk factors. And to do that, the ones that you can control: exercise, eat a heart healthy diet, control your blood pressure, absolutely don't smoke. And the family history, just be aware of your family history and talk to your doctor about what you can do to put yourself on a good path for cardiovascular health. But exercise is really the most important, in my opinion.
Yes, I think that makes sense to folks. Now, we always wonder why people are asking about family history in an office visit, and that's exactly why they need to know.
Right, yeah.
Okay, great.
And for exercise, they recommend 30 minutes most days of the week. You don't have to go out and run a marathon. Just get your heart rate up a little bit and move your body for 30 minutes.
That sounds good.
Yeah.
You don't have to kill yourself doing it. All right. We're going to take a quick break, Britt.
Okay.
Thanks for that great information. As I said, up next we'll be talking about what you can do to strengthen your cardiovascular system. We'll pause here for a short break and we'll continue this conversation after these messages. Stay with us. Welcome back. We're talking to Britt Ballinger and Kristen Palmer. Both ladies are from St. Peter's Health. Thanks for joining us, ladies.
Thank you.
Thanks for having us.
Thank you. So Britt, we did have quite a conversation earlier, but I want to go back to a couple of items and just reiterate, how does a person's family history play into cardiovascular health? I think that's just important.
Actually, family history is probably the most critical risk factor for coronary disease, so it's important to know your family history. So for women, if you have a female relative under the age of 55, a first-degree relative, that's a mother, father, sister, or brother, under the age of 65 for women, who has had a coronary event, then you're at higher risk. And for men, if they've had a cardiac event under 55, then you're at higher risk for a cardiac event as well.
Okay. So can you talk again a little bit more about the risk factors associated with poor cardiovascular health in addition to family history?
So again, family history is the big one.
Yes.
Smoking is a big one, and that one's totally modifiable. So if you have a family history, you really can't get away with smoking. Obesity, keeping your BMI in a healthy range is really important. High blood pressure, if you have high blood pressure, again, that's very hereditary, but it's also very controllable. Mm-hmm. So if you keep your blood pressure under control, then you can really modify the risks. And then high cholesterol, again, hereditary, but also controllable, and diabetes.
Yes. Tell us how smoking actually contributes to cardiovascular issues.
Over time, nicotine can constrict the blood vessels, and over time they become stiff. And also raises the blood pressure, so the consequences of high blood pressure are just kind of magnified with smoking and nicotine. And they put pressure on the lungs, and it all works synergistically, so
Sure.
Smoking really raises your risks of cardiovascular disease as well as pulmonary disease, which puts pressure on the heart.
Thank you. Kristen, to you, good morning.
Good morning.
Let's talk about sedentary lifestyle and how that really does contribute to issues with cardiovascular health.
Britt talked about that it is a risk factor, and I think especially in our country we've kind of had more inactivity in our lives as time progresses. Mm-hmm. So having a sedentary lifestyle actually doubles your risk for developing diabetes and obesity and cardiovascular disease. So it's really important to be able to exercise and to practice that exercise most days of the week. So I tell our patients that It's just like brushing your teeth or bathing every day. It's part of taking care of yourself, and exercise is a very important part of that. You wouldn't go without brushing your teeth, so you shouldn't go without exercise.
That's great advice. One thing we haven't talked about yet, and I'm going to turn to you, Britt, and that is stress. It's so prevalent in society, and I think it's important for our viewers to hear about how stress can negatively impact cardiovascular health.
Mm-hmm. Stress is definitely a risk factor. Those type A personalities, we definitely see a lot more of those in our cardiology office. So if you are a type A person, you need to figure out ways to control your stress, and exercise is actually the best way to do that. Everyone has different things that works for them to control their stress, but exercise, just a 30-minute walk, is known to reduce stress.
Excellent, thank you for that. Kristen, I'm going to come back to you and talk a little bit more about diabetes and how that actually negatively impacts cardiovascular health.
Well, the most common way that it does for cardiovascular health, most specifically coronary artery disease, is it encourages the buildup of plaque on the interior lining of your arterial walls, and cholesterol and plaque. So that creates a narrowing in the coronary arteries that feed the heart muscle with blood and oxygen and nutrients that the muscle needs. So you actually have that increased risk of having a heart attack with diabetes. The other thing is especially with type 2 diabetics, is that they often have other coexisting risk factors for cardiovascular disease, like obesity and high cholesterol and high blood pressure. And so all those actually increase the risk even more for cardiovascular disease.
Okay, great. I'm glad that you hit on obesity. That's important. So Kristen, I guess in follow-up too, so healthy diet can help prevent cardiovascular disease to an extent. And what would you recommend diet-wise for cardiovascular health to our viewers?
I think number one is portion control. Mm-hmm. And we only need as much food as we're expending, really. Mm-hmm. So especially if we're living a sedentary lifestyle, we don't need to eat as much. But also having a variety of foods, fruits and vegetables, mm-hmm. of multicolor and lean proteins, fish and poultry, and the leaner cuts of the beef, incorporating the healthy oils and the nuts and stuff like that. And then also when you're shopping, learning to read labels on what you're buying, and staying away from the sugary foods and high sugar beverages, and keeping an eye on your sodium and your fat intake. And going along with the sugary beverages, it'd be better for you to eat an orange than to have a glass of orange juice, because you have there's bioflavonoids in the orange and other phytonutrients that are good disease-fighting nutrients in that. Plus you have the fiber in the orange. So just staying away from those sugary beverages.
That's great information. Thank you. So Britt, we have time for one last question before we have to go to break again, and I think this is a really important one because it's so prevalent in our society, and that's alcohol. How does alcohol negatively impact cardiovascular health? Can you talk about that?
It's all things in moderation. Especially if you have already been diagnosed with heart disease, then it is a bigger issue. It can definitely lead to cardiomyopathy. So the recommendation is that two alcoholic beverages a week for females and for males, which isn't really fair, but that's just sort of how it works out scientifically.
Yes.
Yeah. But it kind of is an individual thing.
Okay.
But once you've been diagnosed with a heart issue, then it's a bigger deal.
Okay. Thank you. Thank you, ladies. We're going to take a quick break and come back and visit some more after that. So hopefully you'll stay with us. Right. Up next, we'll be talking about cardiovascular rehabilitation. We'll pause here for a short break, and we'll continue this conversation after these messages. Stay with us. Welcome back. Kristen is sticking around to talk with us about cardiac rehab. Kristen, thanks again for being here.
Thank you.
Yes. So let's talk about cardiac rehab. What exactly is cardiac rehab?
Cardiac rehab is an outpatient service, and it's for people who've had some sort of cardiac event or surgery. It's a supervised exercise, and we do also education. A lot of times people aren't in the habit of exercise, so we always start really low workload and small amount of time, and then just increase those things as people can tolerate them.
Excellent. So let's talk about who prime candidates might be for cardiac rehab then.
Sure. So people who've had heart surgery or heart attack, who also people with heart failure are also candidates, and heart transplants too can come.
Okay. Can you get into what the primary benefits then, in detail
Sure.
are for folks who have had one of these situations arise, and what benefits will they see from getting cardiac rehab?
Well, there's two parts. The first one is exercise, because exercise is so important in leading a healthy lifestyle. There's a lot of benefits to exercise. Helps you sleep, helps your immunity, helps with depression and anxiety, also lowers your blood pressure and your cholesterol, weight loss, and all those benefits. It's really, there's numerous benefits to exercise. So that's one thing and having a sedentary lifestyle is one of those risk factors for developing cardiovascular disease. We also focus on education, which is primarily focused on reducing risk factors for cardiovascular disease. So it's a secondary prevention program where we're teaching people, now that you've had this event, now we're going to teach you to make some lifestyle changes. So you'll decrease your chance of having another event, and if you do have another event, then you'll have more of a chance of surviving that.
Okay. So why is it important then for folks to work with specialists in terms of cardiac rehab?
Well, it's because of the education, and it's a motivation for people to come and actually have an appointment to be able to change those lifestyle, modify those lifestyle risk factors. There's also a social aspect to it. So because everybody who is there has some sort of heart or lung problem, and so there's a huge social aspect of that and social support. Also, people don't always. There's some fear in after I've had a heart attack, now I'm not sure what I can do, what's safe to do. And so we do a lot of education for teaching people what are their limits, knowing their body, what they need to listen for. And also people, because they may not have symptoms when they're out exercising on their own, we can, because we're checking their blood pressure and they're on a heart monitor, we can often see things before things come up. So
cool.
Yeah,
that kind of leads into the next question, and that is it dangerous for someone to create their own cardiac, basically their own exercise routine after they've had a cardiac event like that?
It can be dangerous because, like I said, people don't always have symptoms that they recognize. They don't know if their blood pressure is responding in a healthy way to exercise, or if they're having a heart arrhythmia. And people generally are not used to exercising, so if they've had a sedentary lifestyle before their event, then this is really good. And even for people who have had a regular physical aerobic exercise program, it's very good because of not necessarily having symptoms and having potentially dangerous events afterwards.
So I understand there are different phases of cardiac rehab. Can you talk about those?
There's 3 different phases. The first phase is usually done in the hospital with the physical therapist. So the physical therapist will come and get the person out of bed and walk down the hall. The second phase is more the outpatient acute phase, and that's what we do. So you'll be put on a heart monitor, and your heart rate and rhythm will be monitored, and blood pressure and all that, along with the education. So that's phase 2. And that usually takes anywhere from 12, usually insurances will cover 30 to 36 visits, but it can take 3 to 4 months depending on how often you come.
Wow.
If you come 2 or 3 times a week.
Wow, so education is a big part of cardiac rehab then?
Definitely, yes. Yeah, because we're educating on the risk factors for heart disease, and so education's a huge factor, a huge part of that, yeah.
And you mentioned insurance just a minute ago. Do most insurance carriers cover cardiac rehabilitation?
They do, yes. Most insurances, Medicare covers 36 visits usually, so that's 3 to 4 months, and other private insurances as well cover, similar to what Medicare does.
Excellent. So if someone's undergoing cardiac rehabilitation, are there words of wisdom that you would share with them?
Don't be afraid. It's a great program, and making changes in your life, you know, we live most of our lives with these unhealthy habits, so it can be difficult to make those changes, but do it for yourself. Think of it as an investment in your future, for having a healthier future, being more quality of life, being able to do things with more energy and with more ease. Also, as we age, we tend to, as you age, you're going to be more likely to be independent at an older age. So that's very important for quality of life.
Excellent. And then one last thing I wanted to ask really quickly, and that is, how does someone get into cardiac rehab? Is that a referral from their specialist? Is that typically the path?
Usually a cardiologist or a cardiac surgeon or your primary care physician may also refer you.
Okay. Kristen, thank you so much. It's been enlightening. It's been a pleasure having you today, and I know our viewers will really appreciate the information.
Thank you. Thank you for having me.
Thank you. I'd also like to thank Britt for being here today as well. We'll see you soon. We hope you stay fit, stay well, and stay healthy with Healthy Living for Life. Take care.
Healthy Living for Life is brought to you by Mountain Pacific Quality Health. We'd love to hear from you. If you have suggestions for future programs, visit our website at mpqhf.org or call us at 406-443-4020. You can also catch us on YouTube by visiting our website and clicking on the YouTube icon. Special thanks to Fire Tower Coffee House and Roasters. Production facilities provided by Video Express Productions.